afternoon. Thank you for taking your time to learn a little bit more about financial assistance. So my name is Carrie Fortuny Gonzalez. I am a counselor with the SHINE program of the Florida Department of Elder Affairs. And SHINE stands for Serving Health Insurance Needs of Elders. And I'm glad to be here and to share with you today. For some housekeeping matters, if you have a question, you can put it in the chat, the little bubble, and at the end of the presentation, we will go over the questions. And you can also unmute yourself at the end of the presentation and ask any questions that you would like. Also, at the end of the presentation, we will have a slide with my email and phone number. So if you don't get a chance and when you get off and you think about a question, you're so welcome to email me and tell me about your situation and we can establish a chat. So with the housekeeping rules, we will go from there to our presentation today. So I want to tell you a little bit about SHINE. SHINE is under the Department of Elder Affairs, which is the department that funds us. And their vision is for all Floridians to live well and age well. And their mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed healthcare choices. So it is a volunteer-based program. SHINE program is part of the nationwide state health insurance, which is called SHIP. In all 50 states of the United States, there is a program like this one. You might hear it named SHIP because only in Florida it goes by SHINE, but it's the same program. In all 50 states and all 4 territories of the United States, you can find SHIP, which is SHINE in Florida. So I have to read, before starting, a disclaimer. So SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with the local Aging and Disability Resource Center. So specially trained volunteers can assist you with Medicare, Medicaid, and SHINE is completely free, like I already said, unbiased. We do not sell or endorse any plan, and it's completely confidential. When we do a one-on-one counseling with you, it is completely confidential. And there are 11 resource centers in Florida. And as you can see in the slide, where they're located by counties. And they're independent, nonprofit, and they oversee the SHINE program. And what does SHINE can help you? SHINE can help you with Medicare, with many Medicare. We'll go one by one. With original Medicare, it can help you with Medicare Advantage plans. It can help you with Medicare prescription drug and coverage, with Medicare supplement insurance, with extra help for prescription drugs, which we'll talk about that today, with Medicare fraud and abuse, with Medicare Savings Program, which we're going to touch deeply on that today, with long-term care planning, with Medicare complaints and appeals. We can help you with those. So with all of them, the SHINE counselors will provide guidance, will not make the decision for you, but will help you make an informed decision, and also can help you how to detect fraud and how to report fraud. Our next slide. We have a handout. Of course, right now we're doing it virtually because normally we do them in person. I cannot give you the handout right now But if you email me, I can send you this handout. We will be referring to it, but we can still make ourselves understood without it. But remember, at the end, you will have my email, and you can request the handout if you feel like you would need it. So we can go to the next slide. So we're going to start with the first program for financial assistance, which is called the Medicare Savings Program. And sometimes we refer to it shortly, you know, like MSP. So the Medicare Savings Program is designed to help with the cost of Medicare. Jointly, the funds are jointly funded by state and federal finance. So every state has the program, but it's funded differently because it's a combination of the federal funding and the state. So if you move from one state to the other, which I always tell people, you will have to apply for it again if you already have it, because it is state funded too. To be eligible to it, it's based on income and resources. You can apply through the Department of Children and Families because they administer, but we serve as a bridge and we can help you apply for it. If you reach out to us, we will do the diligence of filling out the application and all the paperwork for you. Limited benefits include Medicare Part A and Medicare Part B, deductibles, co-insurance, and co-pays. There are several benefit levels in this program, and they're based on income and resources. We will review these levels in a moment. So we have them here, all the income, all benefits received, not only Social Security, all benefits we have to take in consideration. Pensions and annuities, alimony, all income and wages and contributions. And then we have the resources. So what resources are counted? Bank accounts, cash on hand, stocks, bonds, mutual funds, and IRA accounts. Additional real estate that we don't take in consideration the house you live in is if you have other houses that you rent out, then there will be additional real estate. Cash value life insurance policy when they're over $2,500. Those are the resources. And if you have a car that is your personal car or your spouse has, that's not counted. But if you do have other cars, they could be counted. So like we said before, we will take in consideration your income and resources. And we have another program too in the next slide, which is called Extra Help. So it's an extra help, and we'll see where it helps you. So Extra Help, it's also called Low Income Subsidy. Sometimes you will hear about this program with that name, LIS, which is the Low Income Subsidy. It is administered by the Social Security Administration. It provides assistance with prescription drug costs, so needed. To be eligible for it is based on your income and your resources, like the program we spoke before. It would help you with minimal, it will bring your drug costs to a minimum, especially when you're in the coverage gap. And it would bring on to you a special enrollment period. So if you apply for it, you can apply for it and have an opportunity to change plans one time per calendar. If you are approved for these programs, one time per calendar quarterly. In other words, you can change 3 times a year plans if you are approved by either or one of these programs. So there are 4 levels of extra help based on income and resource. The lowest 2 levels of income and resources, if you are approved for the lowest one, you will pay no premium for Part D or deductibles, which is a great help. So you will have no premium deducted from your Social Security, and you will have no deductibles when you get your medication. Maybe a minimal, it may be a minimal co-payment. If you get approved for the highest 2 levels of income and resources, you will get reduced or no premium at all. And a percentage of the co-payment, you will probably have co-payments, but very low co-payments on your medication, which is a great benefit to have. And remember, it's called LIS. We spoke about the LIS, which is this one, and the one before, which is the MSP. Remember, that will help you pay your Part B, as in boy, and it will help you not have co-payments when you go to the doctor. So there are 2 different ones, MSP and LIS. So the next slide, we want to talk to you about another part of our program, which is Medicare fraud and abuse, which is going on a lot out there, especially now with the COVID. People are coming up with a lot of schemes. So Medicare fraud happens when somebody purposely bills you for a service they never give you, or to build a service that has a higher reimbursement than the service produced. Medicare abuse is different. Is the payment for items or services that are billed by mistake. That's a big word, by mistake by the provider, but should not be paid for by Medicare. So there's a difference between the 2, and that is intent. In the first one, they did it on purpose. On the second, it was by mistake. Next slide, please. So let's see how we can prevent. Scam artists use Medicare numbers to bill for services and equipment that you did not receive or you do not need. Detection. How do we detect? Please, you receive every quarter a Medicare summary notice, MSN. Some people just put it away and don't read it. But please, we ask you from now on to always review it and check for possible mistakes or for possible fraud done intentionally. Reporting, if you find anything unusual, say something. You can reach out to Shine. We will help you report, and we will do any due diligence to help you get whatever they are billing incorrectly. Next slide. So this is our phone number where it says Shine. Shine can help. So remember this number, 1-800-96-ELDER, 1-800-963-5337. So remember, we offer free and unbiased assistance to help with original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance policy, Medicare prescription drug low income subsidy, Medicare savings program, long-term care planning, insurance and financing, and other public and private health insurance we might be able to counsel. And like we said before, we also help you to enroll in these 2 financial assistance programs if you qualify for them. So feel free to reach out to us. Further on, I will show you a slide with my email so you can reach out. So next, you see it there, it has my name, Carrie Fortuny Gonzalez. That's my direct number, of course, in the office, but it'll come to me because right now we're still working from home. 904-391-6644. And there is my email, Carrie Gonzalez at myeldersource.org. ElderSource is the agency, the nonprofit agency, the area planning over here, which we cover 7 counties, but I would gratefully help anybody from any other county. So please feel free to reach out to us. And now we can have the questions, the slide for the questions and comments. If you have any questions, please put them in the chat.